so no problem. I'll give you an appointment next Tuesday. Take a full day off from your work, travel to the hospital, wait for 3/4 of an hour in line, only to spend a couple minutes with the guy, and all he does is give you a bill. So telehealth and technologies like that are the thing that's really going to make a big impact for people's lives and health, because primary care can make that work. So our next speaker is a startup company, and this is why another thing that's interesting about it is we need more startup companies to really make this impact and make the changes that are going to improve people's lives happen. So I'm pleased to have our next speaker. Please welcome Jerome Sebastian, the CEO of Kitika Mobile Healthcare, to the stage. We're going to start.
Hello, good afternoon, everyone. I'm Jerome Sebastian. It's such an honor to be part of a group of such esteemed speakers. I'm also from USD, batch 2010, go USD. But it's okay, if we lose, a typical person from USD will just pick himself up and move forward. Right? We've been in the finals so many times and we've lost, but it's okay. Okay, so I'm going to be talking about telehealth. Now, just to show a raise of hands, how many people here have a friend who's a doctor? Friend is a doctor, okay, great. How many people here consult that friend in times of need or when you're sick? No? Through text, right? How about 3 a.m. in the morning? Sometimes, right? Some of us we can, but for most of us we cannot. And that's what I'm here to talk about. I'm going to talk about telehealth. Okay? So what is telehealth? Based on World Health Organization, it involves the use of technology or telecommunications and virtual technology to deliver healthcare outside of traditional healthcare facilities. So what does that mean? That means that as easy it is for you to purchase an item online during 11/11, it would be just as easy for you to consult a doctor using a mobile phone. Who here purchased something from 11/11? No one. Okay, perfect. Okay, that's how it is. Meaning that you don't have to go to a doctor or travel to a doctor, travel to a clinic, travel to a hospital just to consult a doctor because of your current condition. This is what we call the triage pyramid. So the triage pyramid defines the typical patient journey when someone gets sick. So when you get sick, you probably go to a hospital or consult your doctor for primary care, right? That doctor will tell you to get some tests done and to find out if you need to consult a specialist doctor or if you need to be admitted to a hospital. Eventually, if your symptoms persist and you don't get well, you might have to take maintenance medicines. And this is for the long term. This is very expensive. So as you go up the pyramid, in the triage pyramid, costs rise for yourself, for your family, even for the HMO that you might be tied up to. But by introducing telehealth at the bottom of the pyramid, what it does is it helps you save money. It helps prevent you from having to go through the next 3 phases of the pyramid. You might be asking, how can telehealth help? But usually 80% of the cases through telehealth can be solved and treated through telehealth. These can be your regular cough, colds, you can have abrasions, dermatological cases, back pains. So based on global studies, 80% can be treated through telehealth. So how about the Philippines? These are the areas or countries around the world that have telehealth right now. So as you can see, it doesn't discriminate. It can be from North America, South America, developing countries, developed countries, it doesn't really matter. So all it takes is for people to know about it, for it to thrive. So why not the Philippines? Let's look at some statistics first regarding our healthcare situation and our landscape. There's around 108 million Filipinos right now. One doctor for every 33,000 people. So you can imagine all the doctors lined up. Let's say there's an epidemic, all doctors lined up. Each doctor will have 33,000 people lined up just to be attended to. 1,800 hospitals, and 5 beds for every 10,000 people. This is a reality. As you can see, there's a lack of infrastructure, a lack of medical professionals. You go to different hospitals, not just in the rural areas, even the city, government hospitals. You have 3 people on a single bed sometimes. They're sharing the infrastructure because there's a lack of it. However, the good thing is we're catching up, right? The Insurance Commission has been very good in terms of educating us about the importance of insurance And 48 million Filipinos are insured right now. Going back to the bad side, there's an average of 3 hours waiting time when you're at a clinic. I personally had to go through this. Who here has waited at a clinic or a hospital for more than an hour? That's all of us, right? And sometimes it's inevitable. Not just because of, I'm going to give you a personal case. My wife and I, we had to wait around 4 hours, and we were only third in line. Because the doctor had an emergency at the previous hospital that she was attending to. But that's okay, it's not her fault, it's not the doctor's fault. It's just that there's a lack of physicians and lack of doctors or medical professionals in the Philippines. Another case was that we were 60th in line, that's 6-0. I'm not going to say the specialty because the doctor might watch this. Okay, so we were 60th in line and we had to wait 4 hours. So it's really a problem for Filipinos to have to visit a doctor, which leads to around 57% unattended deaths. So the lack of infrastructure that you see, and all the statistics that I'm showing you right now is a contributor to 57% unattended deaths. They know they're sick. They know there's a problem, but they cannot consult a doctor, or they choose not to because it might be too expensive. Going to an ER automatically, once the door opens, you have to pay automatic 1,000 pesos, for example. Miscellaneous costs, doctor's fee, the IVs that you have to pay for, automatically around 1,500 to 2,500 pesos. You might be too busy. I think we're all kind of workaholics here, that's why I want to be able to have work-life balance. We're too busy to go out to the doctor. If we feel sick, I can wait until the weekend before I consult a doctor. I'll just sleep it off, right? Heavy traffic. Worst city in the world for traffic? Manila. QC to QC? 3 hours, right? I used to live in the Scout area along near Thomas Morato, and we were supposed to go to East Avenue Medical Hospital. It's literally less than a kilometer away, right? It took us 2 hours to get there on a Saturday, horrendous traffic, right? You might live in an isolated location, you might not have any nearby clinics or hospitals, long lines at clinics and hospitals, and this is number one. The reason why most Filipinos don't get the proper medical advice that they need is because we self-diagnose. We get sick, we go to Google, I have a headache, what's the diagnosis? I have cancer. Right? And eventually you take the wrong medicines, and the wrong medicine that you take exacerbate your current condition. Surprisingly, 50% of Filipinos still worry about their health. And I think you'd all agree with me that we all long to have a healthy family, right? We all long to have a peace of mind if we're outside and our kids are at home. And we long to have a long and happy life. So we want to be able to grow old with our kids, eventually meet our grandkids. I for sure do. I have a son who's 4 months old, and I'd love to be able to have a work-life balance now and get myself healthy, go back to the gym. So I also want to keep myself healthy. How does telehealth help in general? Immediate access to nurses and doctors. That means you don't have to travel, like I mentioned, to a hospital or clinic. Medical assistance anytime, anywhere. 3 a.m. in the morning, call a doctor. Less travel time and expense. You don't have to worry about the traffic, the horrendous traffic in Manila, or let alone other key cities in the Philippines. Reduce exposure to other patients who may have illnesses. So some of us might be hypochondriacs. Any hypochondriacs here who worry about sicknesses? Yes, some people do. They don't want to go to a hospital because of the airborne sicknesses that might be around, right? Less missed time at work. We might not have enough SLs or sick leaves to find a leave to go to the hospital. And easier management of ongoing conditions. You might have a current sickness or illness that you want to consult a doctor with, and get some tests read. Telehealth can help do that. So what is our solution? So we wanted to come up with a solution that will address this problem. The problem is really the landscape of the Philippines in terms of healthcare is a complicated and tedious one. Our solution is a hassle-free and comprehensive telehealthcare process, quick access to a doctor, and affordable family-friendly plans. So that is Kitika, that's our company. We complete the telehealthcare solution. We provide 24/7 service, unlimited consultations. So be it 3 a.m. in the morning. In some cases we receive calls that are 4 a.m. Doesn't matter. Our doctors still attend to them immediately. Going back to that. Unlimited consultations. There's whole subscriptions for the whole year, for example. Doesn't matter how many times you get sick, you can consult a doctor. We provide e-prescriptions and medical certificates. E-prescriptions for the lab requests or medicines. And partner specialists. So globally, telehealth lacks physical examination. And the thing is, what we do is we refer you to our partner specialist in case there's a need to do so. So our platform allows you to chat with a doctor, call, or create a callback request, which allows you to have a video call with our doctor. Now, in case you have no credits, for example, you can create a callback request, and we'll be the one to shoulder the cost for the call and call you back. The patient also has access to his own electronic medical record or dashboard, wherein he can go back to his consultations. For every consultation that he has through Kitika, it will be saved to you through cloud, which will also be saved to the mobile application that we have. Can you please play the video?
Feeling under the weather? Don't want the hassle going all the way to the hospital just to wait in line? Don't worry, we've got you. Kitika is your complete telehealthcare solution that makes consultations so much more convenient and affordable. Now, you can talk to a doctor in just 3 easy steps. Sign up, subscribe, and consult. It's that easy. Try it yourself.
That's Kitika. Kitika allows you to consult a doctor anytime, anywhere. We solve the problem of a tedious and complicated healthcare landscape in the Philippines. Although the infrastructure side, that's something that we cannot solve. What we can solve is the immediate access to a medical professional. So our goal is for every family in the Philippines to be able to consult a doctor whenever and wherever. So we're living in a technological age right now, and we're blessed to be in this age, in this era where we can have food delivered in our households, purchase products online. E-commerce platforms are out there, unfortunately killing some of the retail stores. In America, and recently, the largest e-commerce platform, Amazon, they created their own telehealth app also for their employees. They see the need for this. They see the need for all their employees, all their members, all the dependents of their employees to have access to a doctor whenever they need it. And that is our goal. So can you imagine a day where healthcare is no longer considered luxury, but rather going back to it as a necessity? That's what I'd love to be able to see. Especially having a child now, it changed my life. All I do is think about the health of my baby boy. He's 4 months old, and I think about it every time. When he cries, I know something wrong, right? You get very frantic about the health, their future. And for us, healthcare, nothing beats healthcare. We can have all the e-commerce platforms out there to purchase products, to get food delivered. But for me, from my point of view, healthcare is number one. Healthcare is king. Without our good health, we wouldn't be able to live day in, day out with our families. So with that, just one more question. How do we do this together? How do we make it so that telehealth is available for everyone? We have to educate people. Education is paramount, just as Jeff was saying earlier. We have to educate them about it existing in the Philippines so that it can thrive. We're not trying, it's a disruptive technology for healthcare, I agree. But we're also complementing the system in general. Not every hospital in the Philippines can attend to everyone based on the statistics I showed you earlier. Just one doctor for every 33,000 people. And with this, whether you live near, whether you live far, telehealth is available. And with Kitika, we can help. So thank you. I'd like to thank Richard and Rebecca for having me here, and Healthway. It's been a pleasure. If you have any questions, feel free to ask. Thank you very much.
Thank you, Mr. Jerome Sebastian, for that interesting presentation. Kindly stay on stage for a short question and answer session. And once again, may we call on Ms. Harvey De Leon to lead the session.
Hi Hi Jerome, nice to see you
Hello,
again.
nice to see you.
Healthway and Kitika has been talking for a while because we know that we'll be able to address the gaps in healthcare delivery system in general. Like not all of us have a doctor friend that you can call anytime. I can text Dr. Sunny anytime if I have concerns, but not everyone. So it's going to be like offering peace of mind
Yes.
to the market. But I think there are more important or interesting questions from Miss Lynn, who came from Kima.
Yeah, I think they're going to change the game exactly, and it's really wonderful to know that we have this in the Philippines. Now, critical to healthcare is the doctor-patient relationship. So, can you share with us how you establish that through your app and records maintenance? You know, people have doctors who will work with them for 10, 15,
Right.
20 years.
Yeah. So we have a roster of doctors, and they have a schedule. So if you consult Kitika, a doctor will be assigned to you automatically through the queue. But in case you consult again, you can ask for the schedule in case the doctor's not there. You can call them back at that time. And the record of your consultation will be saved through the mobile app, through cloud, and you can see the doctor's name. So you can memorize it, you can see the physician who attended to you. So that in the future, you would know the doctor that you can request in case you want to consult that doctor again.
So there's a relationship because you can always get back to the same
Yes,
doctor. It's online. It's not on site.
Yes.
All right. Yes.
Hey, John.
Thanks for your presentation. I'm interested to know about your education plan because I'm just looking for good ideas about how to approach education from your perspective, or
Right.
mine, or from anybody else this year today. How do you intend to get information around your products and your services, and how will you roll that out?
Well, as a startup company, it's difficult. We're a small player.
That's why I'm asking.
Right, yeah, it's difficult. However, we can have partnerships, B2B partnerships that allow, for example, Healthway would be able to reach out to more people than what we could through social media in general. So aside from social media, it's really the partnerships and word of mouth. So they would be able to, we can create an ecosystem of advocates for healthcare and telehealth that will help spread the word.
It's about collaboration with our
Collaboration,
healthcare
yes.
partners.
Hi, Jerome. When the call is placed, who answers the phone call? Is it a nurse or immediately is going to be a
The nurse first, and you see the triage process.
triage? Okay, that's good. Number one, we're also assuming that these doctors would be, we're talking to would be qualified and licensed
Yes.
Filipino physicians in the Philippines.
Yes, they are Filipino doctors. Yes.
Okay. And then third and last one, which is very, very important, is that is there a particular skill that your doctors are trained to handle, say, emergent or emergent cases? Because, for example, I might just be, just suffering from, let's say, chest pains.
Right.
Although I thought it was just really gas pains, and all of a sudden it's turned out to be a cardiac event.
Right.
What would be your handling of the
Yeah.
case?
So we have a protocol. We have our medical director who's helped us out build the protocol, and we're able to determine if it's an emergency case, urgent case, or just a primary care case. So, for example, you mentioned chest pains. We immediately inform them to go visit the nearest ER, and we're also partnering with Lifeline ambulatory services in case there's a need for the patient to get brought to the hospital. We can connect them to Lifeline immediately. As a primary care provider, we focus on that only, but we're also anticipating a few calls that they might believe were 911. That's okay because we have a partner in Lifeline to take care of that for us.
All right, one more question.
There you go, Richard, I'll give you a mic. My question is related to your prescriptions online. So I know that in the US there's been quite a lot of challenges with being able to facilitate that. How does that work? And also, the second question I have is on the commercial end. So I'm curious to know how you guys make money on this and how it's...
Okay, so for the prescriptions, it's accepted, it's tried and tested in local drugstores. So our e-prescriptions have the signature of the doctor and the license number. And with the universal healthcare law that's been signed, we're going to get more support from this. So they're looking into mobile health services or health services using digital platforms. So it's either Mercury or Drug or other drugstores accepted through just showing your mobile phone with the prescription, or they ask you to print it out. Either way, it'll be accepted. Now, in terms of revenue, us generating revenue, it's a subscription plan. On retail, we offer a yearly subscription, wherein the patient will have unlimited services 24/7 for the whole year. And we also have revenue streams through B2B partnerships. Hopefully, such as the Healthway and others.
So you're approaching individuals and
Individuals.
corporations as
Okay.
part of their company benefits.
Yes.
Yeah, that's a good strategy, and I'm sure a lot of people here are hearing you and are more interested. I know that HMOs are also doing this already,
Yes.
some of them, and I think it's also helping them in terms of past service. Yeah. Okay, so we got 1.24 minutes. One more question?
One more?
Okay, please.
Right.
Karen, you mentioned universal healthcare, so you have your own EMR. So is it compliant to the universal healthcare because they have a certain requirement with that? And then how do you handle the data privacy also since it's a personal health record?
Yes, we're compliant, but we're also waiting for additional rules and regulations that we have to adhere to. So as a tech company, we're able to adjust, especially when it comes to data privacy. Going to that, we have a DPO, we have a data privacy officer, who's undergoing training, and we have scans that we spend lots of money. We spend lots of money on making sure that our data is private.
I think those are the questions I asked him earlier. One last question from the floor.
Hi, hello. Two questions in one. How many doctors do you actually have? Oh, sorry. Sorry. Yeah, how many doctors do you actually have right now in your subscription?
We have around 11 doctors 24/7, so they rotate, so it's a shifting schedule. Our setup is that they're working at an actual clinic, but it's just virtual. So it's the same setup, so that's why a lot of doctors are very interested in our platform, in our service, because it allows them to practice the same thing that they're doing in a hospital, but through use of virtual technology.
Fantastic doctors. Anyway, time is up.
Once again, thank you, Mr. Jerome Sebastian.
Thank you.
Kindly stay on stage to receive the token of appreciation from our representatives from Healthway Medical.